Today, city council members that are part of the LGBTQ caucus held a press conference to announce new legislation that they are proposing. Now, this would be the first legislative package in the country to address monkeypox. And if passed, it would do a few things. It would require the city health department to publish data concerning the total number of vaccines available at the start and the end of each day, the total number of tests available, the total number of cases, and the total number of vaccinated people. It would also require the health department to conduct monkeypox education and prevention efforts.
The city has a record of doing too little too late when it comes to curbing infectious diseases. The communities who suffer most from our inaction are poor and low-income communities, marginalized communities, and communities of color. Now, despite navigating the COVID-19 pandemic, we have failed to apply the lessons we've learned over the last few years to our handling of the monkeypox outbreak.
On another note, we recently told you about the FDA's plan to change how the vaccine is administered. They're going to start giving people 1/5 of the vial in an effort to stretch the limited supply. Well, today, the Washington Post is reporting that the maker of the vaccine, Bavarian Nordic, sent a letter to the FDA expressing reservations due to the limited availability of safety data. Now, I spoke to Lawrence Gostin, who consults for the World Health Organization, and he says context is important here. For example, if the U.S. needs 1/5 the doses, that company is going to get less money. But he says there are some legitimate safety questions that can only be answered by collecting more data.
But we find ourselves in an emergency where people are in excruciating pain, and this seems to be the only way out. So with some significant reservations, I do support it, given the urgency of what we're facing.
Now, the FDA tells Fox 5 they are aware of the concerns from Bavarian Nordic, but they insist that the benefits of the vaccine outweigh the known and the potential risks for the authorized uses.